We run this office as if it were a family, and this is a group effort. I try to have input from everybody, and I value everyone's opinion. We've got a great office. There's just no question about it. I'm a very blessed person when it comes to their staff. Reconstructive surgery is taking basically something that's broken through disease, injury, cancer, burn, congenital malformations. It's taking something that's abnormal and trying to bring it back as close to normal as you can. Cosmetic surgery, on the other hand, is taking somebody that most people would consider to be normal or within the realm of normal, and you're either changing it altogether, or enhancing it, or augmenting it in some way. Now, there's no question that there's an overlap between the two, particularly when you talk about reconstructive surgery having a cosmetic element to it. The word want is the word that's used. Because this is cosmetic surgery, it's unnecessary vanity surgery, period. It's not like you got a tumor growing out of your head and you need brain surgery. There's a want, there's a desire. When the patient comes in, I have them sit down and tell me what it is that's bothering them. And I think that when you talk about cosmetic procedures, it should be about what bothers the patient, not what I think bothers them. I have several areas of education. I was always interested in surgery, first and foremost. I was trained initially as an eye surgeon. When I completed that, I did a fellowship in what's called oculofacial plastic surgery. So the bulk of my practice through the last 34 years has been reconstructive cosmetic surgery of the face, and particularly around the eyes because of my ophthalmology background. It's sort of a logical stepping stone to end up doing more and more cosmetic surgery. I've got a great balance because my practice is about half cosmetic, half reconstructive. So I get the rewards and benefits of both. We have state licensure through Medicare, which is probably the most stringent of those groups that do accreditations, which means that we have the same standards that any hospital or surgery center would have. And so we've been an accredited surgical center for probably at least 30 years. Cosmetic surgery quite often is not done in a hospital, and the primary reason for that is it's usually more expensive. So if a person's going to choose to do that and do it outside the hospital setting, there's an added sense of safety when the facility is accredited. Equipment-wise, we have a lot of state-of-the-art things. All the current lasers, there's a number of non-surgical devices that are used to tighten the skin and melt fat. We've got those as well. And then probably the rest of it is just us as nurses and doctors and the things that we bring to the table. Much like the world, I think cosmetic surgery and plastic surgery in general is constantly evolving and changing, but it's fun. And new procedures come along. Not so much procedures, but technology, like stem cells and PRP. There's all sorts of cool stuff, lasers, so it's fun.